Good evening to everybody. I would like to thank the Congress Organizational Board for giving me the opportunity to deliver this presentation. I'm going to be talking about nutrition, autism spectrum disorder. First of all, let us define nutrition. It depends on the age, gender, and the physiological environment of the individual, and the sufficient intake of nutritional foodstuff. And it is also essential in order to grow, develop the individual, and it also gives satisfaction to the individual. Nutrition is the uptake of foodstuff, which is essential for the growth and development of individual. Actually, it is based on the relation between the parents and the children. And as of the infancy period, homeostatic mechanisms, the rewarding mechanism, the motor, emotional and social-emotional capacity of the person is also taken into account, and the parents, the caregiving, and also the competencies of the caregivers, and the social environment is of close relation with the diet. When we take into account nutrition, parents actually are of great importance in order to shape the nutritional habits of children by actually providing sufficient and quality foodstuff, and also by regularly feeding the child and giving behavioral limitations to children and help them in their nutritional habits. Nutrition disorder is defined as the behavior of not eating sufficient type of amount of food needed for maintaining the weight, satisfying the nutritional needs, and growing against the attempts of parents or child caretakers. So, the personal characteristics, interpersonal relations, and are important when we develop nutritional development. 25 to 30% of the adults do have nutrition disorders. This disorder can be seen in children who grow normally, or else children, of course, have a higher risk when they have mental disorders, behavioral disorders. Autism spectrum disorder and nutrition, it's up to 90%. And most frequently, the nutrition disorders are listed as refusal to eat, and also food phobia, and excessive selectivity of food, and feeling anxiety, actually, which is phobia means the anxiety to intake food. The autistic children, there are strict behaviors and routines. For that reason, nutrition hours are really stressful. And this actually could create aggressive behaviors with parents and could deteriorate the relation between the parent and the child. For parents and children who cannot compensate their needs, the nutrition itself cannot be a satisfactory factor anymore. And it would cause tension, and parents and children would try to develop different nutritional behaviors in order to overcome this problem. Studies carried out reveal that in nutritional disorders, which are so frequently encountered in autistic children, parents actually mothers less touch their children, and vice versa. This is also the case in children with malnutrition, anxiety, depression, domestic complaints, and aggressive behaviors, and in their mothers' anxiety, depression, hostile reactions, and inappropriate nutritional attitudes are seen more. In infancy, shorter breastfeeding and other problems related to breastfeeding is an important problem that causes nutrition disorder. Also, difficulties in the transitional period of the spoon from the baby's bottle, eating rejection and selective eating behaviors against nutrition with a certain taste, smell, appearance, and consistency in the period of increasing diversity when passing through additional food. In advanced periods, excessive selectivity in food, difficulty in eating, and eating phobia, and also having difficulty in eating, and also avoiding new foods, sensitivity to specific presentation of novels, and also too much of persistent intake of one type food, and also Other types of problems, mealtime problems, can be encountered, which all boil down to obesity, growth development, delay in growth. This can be seen as a contradiction, but this growth and developmental delay, and also obesity. Obesity is the chronic disease originated from the fact that the amount of energy intake by the food is greater than the energy consumed, and characterized by increasing in the amount of body fat. It's a chronic disease. Children with ASD have 30% higher risk of obesity compared to children with normal development. This was a study carried out in the United States. Autism and Asperger's diagnosed children, compared to the normal group, they are more overweight and they are more obese. Here, autism and obesity relationship is evaluated. Many etiological factors are put forth. Genomic instability and copy-variant numbers actually are blamed, and also prefrontal angiomia and fragile syndromes, OACB and obesity are seen in these cases, and similar genetic etiology is taken into account. And psychopharmacological therapy is important. It's an important agent therapy which is blamed. And feeding behaviors also do have an impact on autism and nutrition disorders. Emotional eating concept, I would like to mention this. Emotional eating is actually then increasing the food intake against emotional disorders. Not being aware of emotions, not being aware of feelings actually is complaints which lead to compulsive excessive eating, which also can be related with obesity. Autism, they can control their emotions as well, and in order to overcome anxiety, they can also develop obesity, emotional hypersensitivity, sleeping disorders, delayed motor development also are blamed in this nutrition disorders and obesity. And 40 autistic children were included in a study. Male and female height was lower, shorter compared to a normal control group. And nutritional deficiency, genetic and other environmental factors, selective and restricted food intake, and parental diet restrictions actually are important. And especially C and D deficiency, calcium deficiency, they are also a fact. And DiGeorge syndrome, for instance, and shortness of height, for instance, there are also other factors, genetic factors that are blamed, and other environmental factors that also are taken into account. Studies have shown that children with ASD have more digestive system problems than children with normal development. Studies have shown that abdominal pain, constipation, diarrhea, gastroesophageal reflux, gas pain, and distension and discomfort are the most important complaints. When we look at the coexistences of these symptoms, in autism, there are behavioral problems related to nutrition and ASD, which actually is related with the symptoms and histological changes, and most frequently esophageal, gastric, duodenal, ileal, and chronic lymphoid hyperplasia and colitis. They are actually more frequently encountered with autistic patients. Another problem is changes in the bowel mucosal permeability. And the changes in the flora, there can be related with the stress changes, and emotional changes can also have an impact on brain neurotransmitters. I would like to share a study which we have carried out. was carried out in January 2015, January 2016 in Indian University Medical Faculty Child and Adolescent Psychiatric Polyclinic. 104 patients between the year 3 to 12 years of age, ASD diagnosis according to DSM-5, control group of 100 healthy and voluntary children. We measured the weight and height of children. The primary caregiver or parents, we have given them the problem behavioral checklist, eating behavior questionnaire for children, parental feed style survey, development evaluation form, and sociodemographic data form. Of the 104 children in the study group, 84 were males, 20 were females. Children in the study group are more selective while babyhood, eat hardly and have more difficulties when going to additional food. It was determined that the children in the study group were fed with more restrictive diet than the control group. Gastrointestinal symptoms in the study. We see that in the babyhood, the most frequently symptoms are diarrhea, constipation, vomiting, and abdominal pain. Especially in the babyhood, we see that these are more frequent. When we take into account the recurrent symptoms, vomiting and constipation were significantly higher in the research group. When we measured their weights, age and height, body mass index, Z-score was measured, and significantly in the research group it was high, and the height Z-score was significantly low in this research group. In the study group, children were more eager to eat and had emotional overeating, joyful inactivity, drinking passion, less emotional eating, and meal selectivity behaviors. It was again found that the parents of the children in the study group showed more emotional feeding, assisted feeding, and controlled feeding with tolerance as per the questionnaire they filled in. As a conclusion, problems with eating and feeding are more often in ASD. These problems may be related to physical and mental additional diseases. One of the etiological causes of ASD nutritional problems may be eating and feeding attitudes. In brief, nutritional problems at early ages lead to many disorders. The child is unable to develop healthy eating relations with parents since it plays a role in emergence of feeding problems. Depending on this, early diagnosis and treatment of nutritional disorder in ASD gain importance. Thank you very much for listening to me.